Hey guys, hey guys, hey guys, hey. Hey, 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 hey. Whatever. Welcome guys back to my channel. Graveyard Flowers here. Oh Lord, we've had some stuff going on lately and it's just getting out of control. My brain can't quite keep up with all of it. Matter of fact, I got a lot of calls to make this morning. It's going to be a hot as hell day today. So, I'm gonna try and do this pre-recorded, just kind of get my thoughts out onto paper, figuratively speaking. So, as you know, in some of my more recent videos, streams, whatever, I have made mention as to why we don't self-diagnose and why we don't just diagnose over the internet. Because our girl apparently feels the necessity of telling everybody that she is an empath, when in fact, she is showing more traits of a narcissist. So, if you don't know, the history of narcissism comes from the Greek mythology of the character named Narcissus. Guess where we got the name from, right? Right? Okay. So, just to give you guys a little bit of forewarning too, I do mention in all my videos, yes, I am by profession, I am a nurse, not a doctor. And this is not intended to diagnose, provide treatment, provide advice, other than to go and see your actual healthcare professional, doctor, nurse practitioner, etc., etc., etc. Please make sure that you are seeing your doctor at least once a year. Check in with them, see how they're doing, so they can ask you how you're doing. So, and then also, if you decide that, you want to be little miss or little mister, Dr. Google, please vet out who you're doing your research on. Now, it's not to say that some therapies that are unconventional, non-Western medicine are all crap. But if it is good research, if it is good efficacy, you'll find research out there. And you'll see, you know, the test subjects, there were only 5 of them versus 5,000 of them. And the statistics show that in the 5, 100% cure rate. Oh, that seems so great, right? Well, no, that was only 5 people in a small village in the middle of nowhere. 5,000 people, on the other hand, around the globe with only a 2% cure rate. That's a little bit different, right? If you guys understand statistics. I had to take it for very obvious reasons so that I know how to vet out my research as a nurse. So, one of my favorite people that I have been following on YouTube for a very long time is Dr. Todd Grande. He is not without controversy. I'm not going to lie. I don't completely agree, but also you're going to find that kind of healthy disagreement in the medical community. So the thing is that he is not a psychologist, nor is he a psychiatrist. Sorry. So a psychiatrist is an MD, meaning they handle more complex cases and are able to actually diagnose and, like, for example, schizophrenia. That's a very complex mental health disorder. It allows the psychiatrist to give medications that are typically necessary in cases of schizophrenia. Because typically that's really only, and it's not even really, I don't even want to use the word curable because it's not curable. It's really only treatable through medications. Um, Not all the time, and sometimes the medications have their side effects, they lose their effectiveness, et cetera, et cetera. So that's why schizophrenia is very difficult to treat. Other situations are, deep depression, or I don't want to say deep depression, major depressive disorder, certain types of addictions, et cetera, et cetera. A psychologist, on the other hand, is a little bit lower on the, if you have, I don't want to say lower because it doesn't mean that they're not as good. It's a step below, meaning they are able to handle certain psychological situations, but they're not as well equipped as an MD is. So, and then also, I want to debunk some myths real quick about certain mental health disorders. I know everybody has seen movies like House on Haunted Hill. Everybody's seen, like One Flew Over the Cuckoo's Nest. Those movies are either outdated information or over exaggerated information, and that stuff really doesn't happen, at least not in the United States or generally in North America. It really doesn't happen that way anymore. People are not put in straitjackets. We do have to use restraints. There, especially in the United States, are laws against using restraints. Um, in my particular hospital, we're only allowed to do what's called 2-point restraints, meaning that the patient's wrists and hands, that's it. We don't tie down the legs, we don't tie down the head, we don't tie down the torso. We don't do it. In other hospitals outside of my hospital in particular, they are allowed 4-point restraints. It is only able, or we're only able to apply them with a doctor's order. We have to do checks every 2 hours, if not less, to ensure that circulation isn't cut off, that the patient hasn't wriggled out of them and have injured themselves. We have to make sure patient safety is number one, because unfortunately, in a lot of situations, people have been injured in the past by being restrained. And it is 100% for their safety. It is not to punish them in any way, shape, fashion, or form. No matter what you've seen on some ridiculous movie that shows some guy sitting in a corner wrapped up in the, as my uncle used to call it, my uncle's, well, he'd probably be 100 years old by now. May he rest in peace. He referred to it as the happy house tuxedo, which is also known as a straitjacket. Those are not used anymore at all, period. They're dangerous and people have gotten injured from them. We try to remove any restraints. And there's also chemical restraints. Chemical restraints are medications. So nobody is allowed to just, oh, well, give them some morphine, that'll settle them down, or give them some Ativan, that'll settle them down. No, if they are posing a personal risk to themselves, like if they're going to rip out a tracheostomy tube, or if they're going to rip out a line that they need in order to stay alive, because the second that that thing comes out, they're going to stop breathing, or the second that comes out, they're going to bleed to death. Yes, we must keep them on. If you want your loved one to go home with you, you'll understand why we have to do it. And we've had people who are just like, well, I'm sitting here right beside the bed with the family member. I'm going to be watching him the whole time. And they rip out a tracheostomy tube and start bleeding and they can't breathe. Right in front of them, face to face, inches apart from their family member. They have done it. And that's after yelling at us that they didn't want the restraints on, that we were trying to punish them, et cetera, et cetera, et cetera. I'm trying not to be on a soapbox about this, but you guys have to understand we do it for their safety. So anyway, mental health is stigmatized by a lot of these movies. It has not gotten the attention that it deserves. And people like Chantal are just making the situation worse because she's refusing to get the help she needs. And I'm sure that in the past, because I remember when I was younger, I did have a friend who was going through electroshock therapy, and it made him weird. It scrambled his poor brain. They don't do anything like lobotomies anymore. In fact, I think the last lobotomy that was actually performed was something like 1972. Don't quote me on that date or that year specifically. It might have actually been earlier than that, but they have not done lobotomies, which is, if you all are kind of familiar with what a lobotomy is basically an ice pick to the brain and scramble the frontal cortex and the prefrontal cortex of the brain, which is the very part right behind your forehead. And it's not technically an ice pick. That's kind of how it was initially done. So anyway, moving along. Mental health has been stigmatized for long enough, and we don't need to continue that stigma. These people need help. We all need help. We all need people to talk to, and our YouTube channel is really not the place to do it. But recently, our girl has announced to the world, which anybody who knows, if you're empathetic, you don't need to announce it to the world. Empaths or empathetic people, the basic definition of empathy is basically being able to put yourself in somebody else's shoes and understand where they're coming from. I don't personally consider myself empathetic, but as part of the nature of my job, I kind of have to be. Um, I have to put myself not only in the shoes of the patient, but also in the shoes of their family members or their friends that are coming to visit them. So in my own personal past, my mother had had a stroke when I was 16. She was only 51. I've been that family member at the bedside. And so I try and remember what I was going through at that time. Being that I've been a patient, I've not only had gastric bypass, but I've also had an appendectomy. I've had really large cysts removed off my spine. I've been there. I've been the person in the bed, frustrated that, I'm in pain, or that I can't get up out of the bed, or that, I'm not healing as quickly as I want to. I mean, even right now, I'm a patient and I've been going through this for nearly a year. I've been out of work for nearly a year now. And I am frustrated with my own medical community because it's so slow. And I can't get the answers that I want, and I can't just take a pill or just can't have, the surgery that I want to fix the problem right away. I've been through so many hoops and so many tests and so many this, that, and the other. I'm frustrated. So one of the people that I really do enjoy listening to, and he does have some very good key concepts, and he does actually mention throughout his videos that he sometimes will have to discuss with other colleagues to get their opinion, to get their views on an answer that somebody might have asked him. So in this particular video, this one was, I believe this one is 3 years old. I might be wrong. Of course, YouTube is removing dates, so let's pull it up. He actually goes through what is narcissistic personality disorder. And one of the things to clarify is there is actually a difference between the actual disorder and just being a narcissistic person. And then once we get toward the end, it's actually a very quick 11-minute video, but we're going to take a few pauses here and there because there's going to be some key areas that I want to kind of touch on. But at the end is the most important part that I want to touch on, because a lot of people out in the girl world really like to, what's the word I'm looking for? Just like to assign one diagnosis. Oh, she's in liver failure. Oh, she's got BPD. Oh, she's got this. Oh, she's got that. And it's like, no, 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 no. You have to actually look at the whole person. So part of the failure of the mental health system is that they don't treat the mental health situation. Therefore, it leads the person to ignore their own physical health. So, for example, if the person has schizophrenia and it's untreated schizophrenia, and they get, scared that, the doctor or the nurse is trying to give them a medication that, is technically maybe say like metformin to control their diabetes, but the doctor is actually giving them pills because they want them to be beamed up to, cloud nine from outer space. I don't know. I'm just randomly pulling whatever. So the schizophrenia is not treated properly, giving them these hallucinations and delusions that take them away from the reality that they are a diabetic and they need to take their metformin, so their diabetes is out of control. They end up, say, with diabetic neuropathy in their feet, they get a cut, they end up with an amputation. So it's a cluster of things that happen in a human that are out of homeostasis, out of balance. And it's not just one thing. So, everybody, this is why I try and emphasize we don't diagnose people. You can speculate on what might be going on because, a couple days ago, Chantal was saying that she wasn't feeling good. Everybody was saying, well, it's the drug come down, it's her diabetes, she's breathing heavy. And, somebody threw out there, oh, her breathing, isn't that opioid use? And then even Chantal herself thought the other day that cocaine was an opioid. Cocaine is the opposite of an opioid. If she were abusing opioids, her breathing would not be as labored. It would be very shallow and very slow because opioids are respiratory depressants, meaning they slow your breathing. Sometimes we actually do use it still in the hospital for respiratory situations. So, FYI, sometimes morphine itself was originally an antitussant, basically a cough medicine, but it was also a pain medication. But eventually, over time, it became more of a pain medication. It became a pain medication, and but it's still, some doctors still actually use it as an antitussive or antitussant, meaning that it is to help stop coughing or slow coughing because it has an effect on the respiratory system. So in my particular hospital, it's very rare, but in my particular hospital, I have seen it where patients are actually diagnosed, or not diagnosed, sorry, prescribed morphine for difficulty breathing, believe it or not. So here we go. This again is Dr. Todd Grande. Please, 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 before we move on here, go over to his channel if you want to check him out. He's got some very good information. Again, he is not actually a psychologist. He's not a psychiatrist. He's a counselor, a therapist. He does work with people in the mental health community, so he is licensed. He is an actual working therapist, and you can actually look him up. By his accent, I can tell he's from the East Coast, probably the Delaware area. I like to study the patterns that people speak in so I can kind of point out what part of the South they're from or what part of the East Coast they're from, or if they're from Canada versus, Chicago. I don't know. I like studying it, but anyway. So you can actually look him up. He actually is a working counselor. He's also an author, not necessarily an author of literature in the therapy world. He's branched out, but he does have good information, and it's pretty on par with with the medical community. I'll just say that, the medical community, okay?
Narcissistic personality disorder. Now, I'm going to refer to this disorder as NPD for short. So it's important to understand when looking at this question the idea of narcissism. Narcissism sits on a continuum. We need to have a certain level of confidence and a certain level of self-esteem to function and be productive on a daily basis. NPD is an extreme manifestation of narcissism.
And that's one area that I want to start with. So this is why, in my own personal opinion, again, it's an opinion, I don't think necessarily that Chantal is a true NPD. She shows traits, but we'll get into it a little bit further as we go along.
It's over to one side of the continuum. It can only be diagnosed by a qualified mental health clinician.
A good point right there. Again, we are not diagnosing. Even Dr. Grande himself is not diagnosing. In all of his videos, he even puts this disclaimer out there. He is not diagnosing. He is just speaking on a potential situation. Nurses operate on potential situations. Do I think that that patient can walk on their own? No. I consider all of my patients a potential fall risk. It doesn't matter if they're 5 years old or they're 50 years old or they're 500 years old. Everybody has, I'm a fall risk. You are a fall risk. Does it mean you're going to fall? No. I could be wrong 100% of the time, but potential exists.
And there are certain criteria that mental health clinicians look for when determining if someone has the diagnosis NPD. The first is a grandiose sense of self-importance. Oftentimes, somebody with NPD needs to be and wants to be recognized as superior, even though there's no evidence to support this superior standing. And if that recognition doesn't occur, sometimes frustration and sadness can set in for that person.
So, right there, first one, does that sound like somebody familiar? She is constantly in the state of telling you, well, if you don't like it here, then leave. This is my channel. This is mine, 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 mine. She wants to be the most important person because it is her channel. It is her life. And if you don't like it, then you can just get the fuck out of here.
So it's expected. They expect oftentimes to be recognized as being superior.
Once again, really? She expects everybody to go to her channel and give her praise, ass pats, whatever you want to call it. She's even said in the past, people said, if YouTube didn't pay you, would you still be here? And she says, no, fuck no. I wouldn't be here if they didn't give me money. So she's not there for the pure enjoyment of it. She is there because it is solely for her own importance, self-importance. It's solely so that she can make money. Get it?
The next criteria we look for is a preoccupation with unlimited success.
Okay. This one, let him finish making his statement before I cut in here. Sorry.
And with this manifestation, we can see a lot of different occurrences. One would be kind of a fantasy. So a preoccupation with this fantasy of having unlimited success, power, money, fame, and no real clear way that that would be achievable. And oftentimes we find this is unrealistic. It's not always unrealistic, just most of the time it is. And it takes on a nature, either in fantasy or something they really believe they can get, that is far beyond what we would consider normally when we think about being successful or even being famous.
Okay. So I want to interject here. So our girl, as we all know, what is the most common thing that she says when she goes on a blocking spree? She always, always, always says, oh, well, there'll be more coming behind. So she knows that for every person that she blocks, for every person that unsubscribes, for every person that, cancels their membership or whatever, there's going to be another person following behind. Now, in truth, if you really watch, for every one person that gets blocked, for example, that membership is apparently quote unquote canceled. And then all of a sudden, mysteriously, magically, behind that one person comes a new person. It's a pattern you'll see when she goes on these crazy blocking sprees. So essentially, what I think people are doing, and this is again just an opinion, because I have no way to confirm it. Say, for example, I'm just going to throw out, say, Sofa King gets blocked. All of a sudden, out of nowhere, Sofa King is mysteriously blocked. Now, in real life that would never happen, obviously, because he's the ultimate ass patter. But he gets blocked, and then within 2 to 5 minutes, all of a sudden, Sofa Queen shows up. And you hear the, oh, welcome to a very important research, Sofa Queen, and very blah, 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 ready, set, bees. You hear that. So Chantal has this sense that there's always going to be people following her. And she's pissing off people left and right now that her number of subscribers since Cuba dropped below 92,000. It might be actually a little bit above that by now, but she also learned she needs to unblock those people. Because deep down inside, she realistically understands that this is not going to be forever and that she is really screwing up big time right now. She is not going to make this sustainable for herself because of her outbursts. So she's on this continuum of doomed to fail. I'll put it that way. And she has no real clear way of keeping it successful because she's constantly making these promises. Oh, I'm going to get fit. I'm going to go glow up. I'm going to do this. I'm going to do that. I'm going to do the other. Well, right now she's borderline ready to get her channel taken down for the simple fact that she has this tier of promising that people are going to get a postcard. And I think she has yet to actually send anything out. And it's been, let's see, this is June. She started that promise back in March-ish. So it's been about 2 to 3 months now, and not a single postcard's gone out. And she's charging people $15 a month for this. You can't make promises that you can't keep, and she's real good at doing that. Let's go on.
And again, there's no real evidence to support that this fame or power is really going to happen. The next criterion is this idea that someone's too special to be understood by regular people.
Oh, Lord, this one was my favorite. Because the one thing that she absolutely, completely, and utterly pisses me off to no end with, and this is probably, I'm not a violent person, but when she says this stuff, it makes me violent. And our little empath says this all the time. Is, you don't know what my situation is like. You don't know what I'm going through. You don't know what I've been going through with Nada for the last year. You don't know. You don't know. It's my situation. How can you say this? And this is after one of her little VIBzers jumps in and says, I lived with a narcissist. You're a narcissist. You're not an empath. This is after people have said, I lived with, a husband for 10 years and we have children in a house and he was so abusive. He beat me to a bloody pulp every week. And, it took me forever to get away from him, but I finally got away from him. You don't have all that stuff. You don't have this. Now, comparing, your situation to anybody else's isn't always the best way to do it, but you have people that were in way worse situations than Chantal was. I mean, she came away with some bruises here and there, but we don't we didn't see her land in the hospital with facial lacerations. She didn't have children with Nodder. She didn't have anything with him. In fact, he only claimed her for 5 days. So for her to come out there, our little empath, our little person who can feel pain alongside everybody else, is sitting there saying, you don't know what it's been like for me. Like, really? You're going to come up with that bullshit? How dare you? Seriously, how dare you sit there and tell this woman who was put into, a 3-month coma after her husband ran her over with the car because she didn't bring the right brand of beer home or whatever, to, he didn't say, he won't admit that he loves me, when you showed the receipts that he never fucking loved you. I'm sorry, where's my thumbnail? Say that I love you. So our little empath. Our little empath.
So we see oftentimes with somebody with MPD this idea that the people around them really can't understand how good they are, how special they are, but even just understand their true nature, that they're complex. They're complex to such a degree that normal individuals just can't comprehend how special and amazing they are.
Right there. Chantal has delusions of grandeur. That's my diagnosis. I'm just kidding. That's my opinion, is really what it is. Um, I get it. We're all insignificant cogs in an insignificant wheel. I'm sorry, human beings. We're not special, no matter what religion has taught us. We're just not. But the thing is that we're special in the fact that we're not special. We're all unique in our own way, but it doesn't make us better than anybody else or anything else. We're literally cogs in a wheel. And I'm not talking about, like, oh, we go to work every day. I'm talking about the whole universe. We are cogs in a universal wheel. So I get it that Chantal feels insignificant. I felt that way when I was 283 pounds. I felt that way, as a child, as a teenager, as an adult. We all have felt that way. We all have those moments where, we want to feel special. We want to feel something. But being based in reality, we know you can't please everybody and you can't be perfect for everybody. But with Chantal, she has this overarching need to be special. She needs, it's her channel. She was trying to flex the other day. I think it was on Nodder. It was either Nodder or Gary or something like that. She was trying to flex on somebody. Well, I have 92,000 subscribers. And you guys, if you go over to her Beezer Show channel, only 7,000 people followed her over there. So she supposedly has 92,000 subscribers, but only 7,000 of them followed her to the Beezer Show when all that drama happened. So roughly 80 something thousand are dead YouTube accounts or purchased. We don't know. Only YouTube would know. Anyway.
But certain special people could. And oftentimes this takes the shape of famous people. A certain famous actor or business person or politician, maybe they could understand, but a normal individual couldn't.
And how often do we hear her use the term like glow up, which she got from Paris Hilton? Let's see, she's been referencing Amber Heard a lot lately, which if she'd actually, just like Google news, it like takes 5 seconds to freaking read about it. She'd know that Amber Heard is the bad guy. The media has basically crucified her after she tried to crucify her ex-husband because she tried to pull some shit. She made it damaging for all women and all victims of abuse. And all Chantal has to do is pick up a fucking book, which is another favorite thing that she's been doing lately because her little empath thing came from a 2-hour video from HG Tutor. Now, HG Tutor is definitely a controversial figure on YouTube because he is not a licensed therapist in any shape, fashion, or form. Shape, fashion. Wow, I said that weird. He's not licensed in any shape, fashion, or form. He says, under the guise of anonymity, that he is, I think, a diagnosed narcissistic psychopath. I They don't use psychopath in the United States. That's actually considered a slur here. Um, Ever since the movie Psycho came out and blessed the mental health community with everybody thinking that you can just sling that word around. So, but psychopathy or being delusional, being out of touch with reality, it's an umbrella term, uh, which is The psychopathy, suffering from psychopathy, is an actual term that doctors will use. It just means that, they are out of touch with reality. A preferred way to do it is to give a specific diagnosis: paranoid schizophrenia, schizophrenia. Those are types of psychopathy. They would rather give it its proper name than just be like, this guy is psycho, because we don't do that. That's slander. Somebody could be temporarily out of touch with reality. Dementia is a psychopathy. Um, Delirium is a psychopathy. It's a temporary state, or in the case of dementia, it's a permanent state of being out of touch with what's going on, because dementia destroys your memory. So you could suddenly revert back to thinking it's 1950, and you're wondering where your neighbor Gladys is, and your neighbor Gladys has been dead for 50 years. So we don't use the term psycho. Just like Chantal's favorite R word, which I'm going to say, in the 1960s, it was coined the term mental retardation. But because people are so cruel, they love to shorten it and take off the word mental and use the word retard, and then shortened it even further and called people tards. And they were slinging it around as an insult. So calling somebody a psycho, we've all done it. We've all been guilty of it. You don't call somebody a psycho. Oh my God, my psycho ex. Well, have they been medically diagnosed as being out of touch with reality? Or are they just having an emotional moment because you guys shared a pet and they want that pet and you don't want to give them that pet? Or because they made you a mixtape and you didn't appreciate it? God, I'm so old. Mixtapes. They made you a Spotify playlist special just for you and you didn't appreciate it enough. And they got a little sad over it. Does that make them a psycho? They're crazy? No, it doesn't. Nobody in the who needs mental health help is crazy. A situation might be crazy. Oh my God, we were flying down the highway and this guy came to a screeching halt in front of us. It was a crazy situation. Oh my God. Okay, that's fine. But it's really detrimental to the mental health community to be calling people crazy just because, and we're all guilty of it, and there's times where even in my own head, and it might actually slip out. I mean, oh my God, it was this guy was so crazy, he went crazy on me. It's such a normal part of our speech, but we need to fix it, and especially in the terms of using the word psycho, because that's even worse. And especially don't use it toward people who actually do have mental health issues, because that's not fair. You can't help being schizophrenic. You can't help that you slipped into depression and nothing seemed to be the cause of it. You can't help that you suddenly had a panic attack out of nowhere. Mental health is something that you, when working with a doctor, can help. And you can work with on your, or you should say you should work with yourself on it. But you have to be proactive in helping yourself. But the cause of the mental health problems can't necessarily be helped. Sometimes if, you just have a panic attack because something seems to be too stressful in your life and it's not in your control, like you have a panic attack because your ex who used to be abusive, you have to see them because you have to go to court, whatever, just pulling out random things, and all of a sudden you have a panic attack in the front of the courthouse while you're standing there with your lawyer because you're anticipating that your abusive ex is going to be within 5 feet of you and you're terrified. You can't help that situation. So, but what you can do is you can work with a therapist who can actually say, okay, when you're in that type of a situation, you need to know there's people around you, you're going to be safe. Always make sure to reassure yourself you're okay. It's just a temporary condition. You'll get through it. You're going to be okay. You know, there's different ways. Obviously, I mean, I'm not a therapist, so I don't know exactly what they're going to tell you, but you get the gist of what I'm saying. Anyway, I'm going off on a tangent. I really, sorry.
So this idea of being too special is one of the criterion. The next area is when an individual needs excessive admiration. And
Oh, Lord. That's my other favorite. So guess who that sounds like, right? Guess who that sounds like? Now, going all the way back, we don't really 100% know the situation between the original relationship between Pete and Chantal, but we do know the reason why Chantal claims that she cheated on Bibi was because she was bored and she didn't get enough attention. She started doing live streams. She started doing all of this stuff, you know, to make her presence more out there because she needed the praise and attention. And of course, she got into all of her little internet beefs with people like Charlie Gold and Amber Lynn and all these other people. She got into all her little beefs because she couldn't handle the fact that she wasn't being praised all the time. And then it eventually led to her doing these constant live streams where they are members only. So, yeah.
And this points to kind of an interesting topic of self-esteem. There are a few different theories about self-esteem and individuals with NPD, including this one theory that suggests they actually have high self-esteem. I'm going to have to agree here with what's in the DSM, the Diagnostic and Statistical Manual. Based on my experience treating this disorder, I would say it's not the case that we see high self-esteem, but rather almost all the time we see low self-esteem, a particularly fragile self-esteem for people.
And I agree with that when it comes to Chantal. We all can see it. You cannot deny that this woman has self esteem that is not just in the toilet, it is below the toilet, in the sewer, even below the sewer. She is in a constant need of praise from outside sources. And I mentioned this in videos a long time ago that she has, it's referred to as an external locus of control, meaning the outside world affects what happens to her. She has no control over her own world. So if people are cruel to her because she thinks that the world hates her because she's fat. No, they don't hate her because she's fat. They hate her because she's a bigot, she's rude, she's mean, she's vile, and she's disgusting. But it's all our fault. It's the outside world's fault. And all she has to do, and you could see it with her earlier videos when she did pre-recorded videos, she did that because she could put on that persona of being proper, chewing with her mouth closed, not picking her nose and wiping it on her on herself or her under her desk or wherever she wiped it, not vomiting on herself, not making finger guns while mocking school shootings. But she refuses to do that. It's like now she's in this constant loop of needing to be praised.
People with this disorder. So they're looking for this excessive admiration, and really their self-esteem is low. Oftentimes with this excessive admiration piece, we also see somebody who looks for compliments in normal conversations. So they put
What do we do all
information
day on
out
a live
there
stream?
in an effort for somebody else to recognize how special they are and give them a compliment. Another element we see with NPD a lot of the time is the sense of entitlement. They expect somebody to look at them favorably, people that suffer from this disorder. Again, there's no reason necessarily that they would expect that other than the disorder. The amount.
I'm right there. She's constantly needing people. I right there. I can't even say it.
amount of entitlement they have exceeds what would be expected. So everybody has some sense of entitlement. With NPD, it's greatly expanded. The next element is exploiting relationships.
Oh, Lord, here we go. She exploits every relationship that she has. And this isn't geared just toward people in intimate relationships. She exploited her friendship with Shannon when they were teenagers. Shannon said that she used to always sleep over at her house. She was constantly at her house. She exploited her friendship with Pete. She used to go to Pete's mom's house. They would get drunk and have sex or whatever. She exploited Pete himself when they moved in together. She even more recently said that, she went on to put him in financial ruin. Then she cheated on him, then went with BB. She was working, she lost her job. She didn't have a job when for most of her and BB's relationship, at least toward the end, she didn't have a job other than doing YouTube and trying to make money that way. That's not a job. But she wasn't bringing in the money. So she was using BB to fund her mukbangs. She was using BB to pay for the rent for the apartment. She was using BB to pay for all of her little makeup hauls. So, and then now she used her uncle when she needed her help to come off the cocaine addiction that she supposedly had. She used her aunt, as, oh, she's spicy auntie or whatever they call her. We're going to go to Jamaica and meet men. She more recently claims that uh, she borrowed money from her family because she already blew through her YouTube money. So she doesn't just use like people in intimate relationships. And of course, beginning with Nader, she used him for YouTube content without his knowledge. She exploited him for views to boost her views, and he got pissed. This is a first time that she's actually met somebody who pushed back. And in that sense, and I hate defending this guy because he's a piece of shit, but I don't blame him for being mad. He's a grifter. He didn't want to be found out. And we're learning more recently, if you haven't seen Mo Translates, that, he's been lying about some of his information and some information's been questionable. But he's doing things that are a little sketchy, but he didn't want to be found out. He didn't know that he was being made public. And here she is making him fucking public without his knowledge, and she's exploiting that.
And a lot of times this is thought of as being deliberate. If somebody's exploitive in interpersonal relationships, it's a deliberate attempt to be that way. But when I think of NPD, I often think of this as an unintentional consequence of the disorder.
And I agree with him on that, but in Chantal's case, in certain instances, I do think it's deliberate as well as an unintentional consequence. There's times where I don't think she realizes that she is exploiting people, and there's other times that I think she's really doing it purposefully.
Not a conscious decision. Part of the entitlement, part of the needing admiration leads to exploitation. Certainly, sometimes it can be intentional. Which brings me to the next criterion, which is a lack of empathy. Now, this is a
Oh, ho, 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 ho. I'm sorry, Doc. Let's take that back 10 seconds.
to exploitation. Certainly, sometimes it can be intentional. Which brings me to the next criterion, which is a lack of empathy. Now, this is an element that we see shared between narcissistic personality disorder and antisocial personality disorder. And again, I think sometimes this is conceptualized as deliberate, that somebody's ignoring their ability to empathize. But really, with this disorder, and with antisocial personality disorder, it's an inability for the most part, to recognize the feelings and thoughts and goals of other people.
And that's an important factor, though, too, is that that lack of empathy, as he states, is you can see it across antisocial personality disorder, which it's been said, say like the BTK, which is the blind torture kill, Dennis Rader. He's an antisocial personality disorder sufferer, if you want to say, even though he made everybody else suffer. Um, but it's also seen in narcissistic personality disorder. So that's why you have to be really careful with diagnosis, is because of the fact that it carries across multiple disorders. That's why I'm saying that even now, I can't necessarily diagnose Chantal as being narcissistic or NPD, because for one, it's not in my professional scope of practice, but also I don't know her one to one, and you can't make a diagnosis of NPD in just one sitting. Now, of course, she goes live for 6 hours a day, all day, every day, and crazy person. Oh, see, I just did it. I just did it. Caught myself. Um, it's out of this world how she can do all these live streams like this, and we all feel like we can diagnose her with anything specific, but you'll see these traits across multiple spectrums. That's why when a lot of people like to throw out that she's BPD, she's BPD, she's BPD, and I'm like, stop it. She shows traits of BPD, but she also shows traits of NPD. She shows traits of APD. She shows traits sometimes of schizophrenia. If you guys have ever seen it, there's certain streams where she gets all lit on whatever and she starts making faces and looking around and kind of showing these weird, like, little moments where it seems like she might be having some kind of auditory or possibly visual hallucination. So let's move on.
Somebody with this disorder simply can't connect with the nonverbal and verbal cues that indicate what type of feelings somebody has.
And just the other day, when Pete came in and told her just to knock it the fuck off, he came in and said, stop with the drama. People are getting sick of it. People are getting annoyed with it. People are getting, and she just, and then just ignored him and moved on. It's his apartment. He also lives there. And from the moment they moved in together, he was just the name on the lease. And a lot of people, and this is why I kind of defend Pete's a bit more, because he moved in, and really the only room in that house that is truly his is his own room. And people are, oh, well, he never comes out. He's a shut-in. He does this. He does that. He doesn't drive himself. And they'd like to kind of like nitpick all these little things. But it's like, okay, from the moment they moved in together, she made him unwelcome in his own home. She doesn't see that when she gets all these Amazon packages, she just throws the garbage from her pannier all over the fucking apartment, that, she's invading his space too. She doesn't empathize with the fact that he doesn't want to sit in filth, so he would rather go and sit up in his room, festering in his own filth. But that's his own filth, because that's the only place that he's got to go. He tried to come at her when she was on that paneer kick a few months ago, when she was eating paneer like every day, all day, every day for like, what, 2 weeks straight almost, that he actually got on her because she had taken the containers and left them like out on the dining room table. And he was just like, why can't you throw this stuff away? Why can't you put it in the refrigerator? It's just been sitting out here. This is disgusting. Like, those weren't his exact words, but it was something to that effect, that you could actually see he was getting annoyed by the fact that he couldn't even have a clean environment. And it was kind of getting put on his doorstep, but I kind of passively aggressively see why he doesn't want to clean up after her. It's not his mess. So why should he constantly be following her around with a garbage bag and a vacuum to clean up after her disgusting, piggish lifestyle? So instead, he would rather just not start an argument. He would rather just hide in his room and live in his own filth. And I get it. It's disgusting on his part too, but it's also his villa and he should be helping out too, yes. But To what degree? Because we've seen her go in a 24-hour period from being an absolutely pristine, perfect environment that her mother cleaned up for her, or her aunt cleaned up for her, or that she worked so quote unquote really hard to do, and then 24 hours later there's just shit everywhere. Like, I don't understand. And this is where I get like, I get ragey about this. I don't fucking understand how she can literally clean everything, like wipe everything down, everything's in the dishwasher, everything's been scrubbed, everything has been completely cleaned up and thrown away, and literally in 24 hours it is everywhere again. What the ever living fuck?
They
Sorry.
can't pick up on what we refer to as affect, or the presentation of feelings that somebody has. The next element here is when somebody is envious of others and they believe that other people are envious of them. We see this with NPD. And again, it's unrealistic.
And right there, she tries to throw that at Dee Dee all the time. We can see how envious she really is of Dee Dee, and she tries to throw it out there that, she tries to throw it as a flex that, Nodder is Dee Dee's problem now. Nodder is this now. But it's really, she is envious that Dee Dee had won the guy, but she thinks that Dee Dee should envy her because she was the one making 20K in a month. Even though in truth, most months she was probably making about 10K at max, 10 to 12 max during the whole Nodder saga. But, there was that one really good month that she did have where she made 20K. Well, she has nothing to show for it. So there's really nothing to envy, but she's still trying to constantly flex. Constantly, constantly, constantly. And she's always going after Dee Dee. And it's always Dee Dee. It's never anybody else. It's really more particularly, it is Dee Dee. But then whenever, say one of her VIBzers crosses her path and pisses her off, she still tries to flex, oh, well, I'm the one with 92,000 subscribers. I'm the one making 10K a month. I'm the one who's got this. I'm the one who's got that. You need to envy me.
Everybody at some point has envy for other people and may believe to some extent that somebody envies them in some way. But with NPD, again, it's taken way out of proportion. It's much greater than the evidence supports. And like most of the traits with NPD, they are in fact traits. They are something that we see chronically. So that envious state that we would see in individuals that fall within normal limits, we don't see with NPD. It's more of a trait. That envy is there a lot of the time. It's chronic.
And this also, too, I think she feels a sense of people envy her. Well, I should say people like, say, for example, Amber Lynn envy her because she is the one with the girl crown. So everybody should envy her because she is the stereotypical fat person who has 92,000 subscribers. Everybody needs to envy her because if she were to even fathom that us peasants below her could have that many subscribers and be a fat girl. So we all talk shit about her being fat, but look at where she is. She's at the top of the heap with her crown on. And it's bullshit. She's constantly trying to flex. Constantly, and it's, to me, it's just her own low self-esteem and self-reassurance that she is not what everybody tells her she is. And again, it goes back to her focusing on the fact that she's fat. And it, again, has nothing to do with the fact that she's fat. Nobody cares. I used to have that level of thinking that people were after me because I was fat. When in actuality, nobody really hated me. But I didn't, I had this expectation and this need to make people like me before they could hate me. So I always wanted to be the funny girl. But then I finally realized, you know what? I'm not everybody's cup of tea. I try to be. I try to be a friendly person. I try to be nice all the time, but I don't get along with everybody. And that's just how it is. That's just the way the world works. Plain and simple.
As part of this element, sometimes we think of this idea that somebody with NPD tends to devalue the contributions of other people. So they may be working on a project, and that project may have been successful, and they may say that they deserve the vast majority of the credit for that project's success, and that other people's contributions were okay, they were helpful, but they just weren't special.
And she's been doing that a lot more lately too, when the fact that, she is the one who got Nodder on YouTube, and we're all still angry with her about that. But constantly going after him for like, who's the one who helped you start your channel? I paid for your groceries. I paid for your rent. I paid for this. I bought this, you broke ass bum. Just squealing into the void, if you will, about how she is the one who should be the one who is admired because she did everything. I mean, within what, 2 or 3 weeks of meeting Nodder, of meeting him, she was already saying, after all we've been through, after everything I've already done for you, like, really? Really? You're gonna go there and try and flex that you're the one who's the sole reason? And like, Nodder still didn't have his own YouTube channel for a couple more months. But now she's, well, if it wasn't for him, he wouldn't have had his cooking channel. He wouldn't have had his food from Adonis. He wouldn't have had this if it wasn't for me.
And they weren't important or crucial to the project. The last criterion in NPD is this idea of arrogance. And a lot of times we see this expressed in terms of an NPD sufferer being condescending toward other people.
I'm just going to use one word to describe, and if you guys know what I'm talking about, I'm just saying the word relish.
So they may go somewhere like a business and receive a service from somebody and rate that person as inferior, their abilities as inferior, maybe indicate that they're not competent. And they may tell that to a third party and not.
And she does this with, let's see, she didn't want to go to her blood work appointments because she needed a nurse or a phlebotomist. Phlebotomist is a person who draws blood. She needed a nurse or a phlebotomist that knew what they were doing. Then we see her constantly bitching about her Uber Eats orders and she wants a refund because they didn't get the order right. She's berating Pete that it's not her fault that, his channel isn't doing well. She's constantly berating Natter, and then of course reneging that his food is crap, his food is good, his food is crap, his food is good. She can't make up her fucking mind on that one. But you get where I'm going with that. And then of course Mr. or I shouldn't say Mr. the relish man in Cuba, and how she's berating all of white people, she's berating all of the United States, and she's berating entire groups of people because they are beneath her. Canada, well, I guess technically, the United States is technically really beneath Canada if you really look at it, geographically speaking. But she talks down on America because of our gun laws. Like, we haven't been fighting against it for years, and that hasn't been a problem for years. Nearly 30 years this has been a discussion about school shootings. Nearly 30 fucking years this has been an issue. And we are constantly talking about it. And if she was in any way, shape, fashion, or form up to date on anything going on in the United States, which she's obviously not, she wouldn't have this delusion of grandiosity above, United States, you are all beneath me. You're all beneath us. Canada is so much better. Go fuck yourself.
Not directly to the person that they're essentially accusing of being incompetent, or they may tell that person There's different levels of arrogance we see with NPD. So when looking at narcissistic personality disorder, we can see that somebody with this disorder typically does not do well with criticism.
Shocker.
They respond poorly to criticism. They often take criticism as humiliating, and this can lead to shame.
And a lot of people have brought this up that they feel like Chantal doesn't actually feel any sense of shame. And I actually very wholeheartedly disagree with that. I think she actually does feel shame. I really genuinely do think that she does experience embarrassment. But her little flippant, oh well, is a defense mechanism. So she's constantly flashing body parts. She's constantly being obnoxious. And that is her defense mechanism against her shame. Because her shame is what she wears on her body day in and day out, all day, every day. Her shame is the fact that she can't stop overeating. Her shame is her mental health. Her shame is that she makes promises that she can't keep, or I should say, in the past, she made promises that she couldn't keep, like her weight loss. She would come on, she would say, "You guys, I really can't do these mukbangs anymore. It's really not healthy for me. I have an eating disorder. I need to fix this problem. I need to do," and then she would fail, and she would let the trolls get to her. So she would address the trolls versus addressing the other people who say, "Girl, we are here with you and we are here to support you." And she still does it to this day. But her shame comes out in the way she lashes out at everybody. So when I first started watching her, because I had already lost my 150 pounds after having weight loss surgery, I saw another person that I was willing to cheer on because I have been there. I said, "Girl, I've been there, I've been there, I've been there. You are unique, you are valuable, and you can do it." And I say that to anybody who wants to go through weight loss. I say it to myself still because, yeah, I have regained some of the weight, which is natural. But those days, and even because of my swirly brain issue that I'm having, I get out there to take my walk and I say, "You're not going to let your brain stop you." And I feel shameful because, I went from running 40 miles a week to barely being able to walk 4 times around the block without needing my cane to get around. It's embarrassing. And I think Chantal really does actually feel shame and embarrassment. It's just the way she chooses to lash out like a toddler rather than saying, "You know what, fuck the trolls. Yes, they're going to make fun of me because I failed yet again." And there are going to be some people out there who say, "We've been cheering you on for a year. You've been saying this for a year." And then you turn around and you fuck it up and we're tired of it. There are going to be people out there that are like that. But the people that you need to listen to are the people who say, "Look, I've been there. It is a struggle. Eating disorders are not easy to get through. Any kind of addiction is not easy to get through. But what you need to do is learn that you have control over the addiction, not the other way around." I was addicted to, or I shouldn't even say was, I am addicted to food. I love to eat. I absolutely do not deny I love to eat, even after gastric bypass. And I do suffer from the consequences of eating incorrectly from time to time. It happens. But I don't consider myself an epic failure, and I don't listen to trolls telling me I'm an epic failure because, yeah, I did lose 150 pounds and I gained back 40 of it. I don't listen to my own brain telling me, I don't listen to the outside world telling me that I am a failure. I'm not a failure. You are not a failure. And I'm not embarrassed. It's going to happen. Life is not perfect. But Chantal is absolutely embarrassed by everything. And she does feel shame. So that's just, again, it's my opinion. A lot of people think that on the outside, because she's flashing all these body parts, to be honest, she really is doing it by accident because the way her body is built and the way her arms and the way her clothing is and all that kind of stuff, she can't tell. She doesn't know that she does it until it's pointed out to her. And rather than sitting there going, oh my God, my face is red, I need to turn it off right now and just go into my closet and die of embarrassment, where we've all been before. We've all, accidentally farted somewhere, or we've accidentally burped really loud and didn't expect it, or we've all done something embarrassing in our lives. And we've all wanted to go climb underneath the bed or hide in a hole and just die of embarrassment. We've all been there. But rather than do that, she just kind of brushes it off and makes it seem like she's not embarrassed, but that's not the case.
Again, I believe this is consistent with the idea that most people that have this disorder actually have low self-esteem. With this shame, especially if it continues for a while, this can lead to depressive symptoms. Now, in looking at the excessive need for admiration, if that need is met, this can lead to hypomanic or manic symptoms. So we can see depressive and hypomanic and manic symptoms in individuals. Sometimes we can see this in individuals with NPD. Other illnesses that are comorbid with NPD, meaning they can occur at the same time or they're more likely to occur, would be anorexia nervosa and substance use disorder. In particular, we see an elevated risk for cocaine use disorder.
Wow. Who does that sound like? Now, he specifically said anorexia nervosa. I kind of don't like that he pointed out that one in particular. Um, from, again, my opinion, I disagree specific eating disorders. I think just eating disorders in general. Because there is binge eating disorder, there is bulimia, there's anorexia, etc. Um, so I think eating disorders is better to say, but he also does go with specifically cocaine. Now, I don't like that he said specifically cocaine because, like when you have narcissists, or well, I should say narcissistic personality disorder. I'm sorry, but cocaine is the rich man's drug. Um, it's, as other people have described it, it's the high class drug. It's not really, obviously, no drug like that is high class or a rich man's whatever. It is more expensive in general, depending on the habit or the addiction of the person. So some people might start off with cocaine, but they'll downgrade to either crack cocaine or methamphetamines because they are more quote unquote affordable, aka cheap. So if it's a long-term user and they need to downgrade, yeah, they'll go to something like meth or whatever. So if you have somebody who's narcissistic personality disorder and they're not functioning in society and it becomes way overboard, then yeah, I think they'll downgrade out of a cocaine habit, but they still want the high of the cocaine. So they'll switch to something like crack cocaine or methamphetamine. So that's where, and that's why I say, like, I don't like specifying anorexia nervosa. I would rather say bulimia nervosa, anorexia nervosa, binge eating disorder, because they're they're all eating disorders. So, you know, you have, bulimia or anorexia. Anorexia is the poor man's version of an eating disorder because then that way you don't actually have to buy any food. Um, and I'm sorry, I'm not trying to be disrespectful. I'm really not. I mean, I've already admitted it. I like food and I feel like I am a food addict. It does occupy a lot of my brain a lot of the time during the day. It's not going to go anytime soon. So, if anything, I'm taking a dig at myself because I was a binge eater. I still try to be a binge eater here and there. It doesn't happen, but I still try. Um, That's one of the beauty parts of my Roux and Why gastric bypass is that it actually prevents me from being a binge eater because I become uncomfortably full very quickly. Speaking of which, I haven't even eaten yet. Anyway, um, so I don't like him that he specified certain eating disorders or certain addictions because I think with NPD or any of the personality disorders, the potential for addiction is there. And addiction can happen as we're learning. Addiction to anything can happen. So addiction is not just drugs, addiction is not just alcohol, addiction is not just food. People can be addicted. And this is one I was actually praying for before I had my gastric bypass, is I was like, I want my cross addiction to be exercise, not shopping. And sure enough, it was exercise to the point where I was actually injuring myself. And I had to slow it down, which is part of where my regain came from because I hit 133. My lowest, I think, was 128 pounds. At 5'8", I was a twig. So I averaged out at about 133 for the first couple of years. And then it gradually started to come back as I started to get more injuries and I had to realize I had to taper down my exercise. So that 40 mile per week running habit was causing me injury. So I had to taper it down, taper it down, taper it down, not go in excess like I was. But in the process, because I still do have my issues with food, my weight started to taper up. But anyway, these last 2 minutes are the most important that I really wanted to get to.
As far as other mental health disorders that would be comorbid with NPD, we would see other personality disorders like borderline, histrionic, antisocial, and paranoid. They would be comorbid with this illness.
Right there. Let's take it back 15 seconds here.
Pain use disorder. As far as other mental health disorders that would be comorbid with NPD, we would see other personality disorders like borderline, histrionic, antisocial, and paranoid.
Right there. So when you have a comorbid condition, that means that they potentially are not just in this niche of narcissistic personality disorder. You can't funnel all of these symptoms into one specific disorder. So just because they have narcissistic personality disorder means that they could also have borderline personality disorder. They could also have antisocial personality disorder. They could have a combination of any of those. That's what makes mental health diagnosis so much more difficult because you can have one mental health disorder, but you could also show tendencies toward another, and they crisscross into each other. So everybody likes to pigeonhole everything. And it's the same thing with, physical medical diagnoses that, everybody likes to say, oh, well, because she's fat, she's a heart attack risk. And it's like, well, she's also at risk for diabetes. She's also at risk for polycystic ovarian syndrome. She's also at risk for respiratory failure. She's also at risk for dementia or Alzheimer's. So you can't pigeonhole any one thing because there are people who are obese who die of a heart attack, but never once did they show signs of diabetes. You can have obese people who have diabetes and they have perfect triglycerides and perfect LDL and HDL cholesterol levels. It's not, you can't just pigeonhole them because they are obese that they are stinky. Because they are obese, they have this. Or because they're male, they're good. Well, the only one you can pigeonhole is that if they're male, they have prostates. That's kind of always one of my little funny go-tos is that like I would have a headache or something like that and I'd just be like, "Oh God." And somebody, "Well, what's wrong?" And I'd be clutching my head and I go, "God, I don't know, my prostate's enlarged." That's one of my little kind of go-to moments of brevity. So, you can't always pigeonhole everything into one little neat little package. It's just not how the human body or how the universe works. So a lot of people love to just solely say she's borderline personality disorder, and I'm just like, no, she's showing multiple symptoms across multiple disorders. And so let's take it back again.
Other mental health disorders that would be comorbid with NPD, we would see other personality disorders like borderline, histrionic, antisocial, and paranoid. They would be comorbid with this illness, meaning they'd be more likely to occur in somebody with NPD than somebody that does not have it. And in terms of prevalence, there are a lot of different studies that show a lot of different numbers for how prevalent NPD is.
I'm just going to cut it off right there because the whole prevalence issue, it's really hard to get true prevalence on a lot of mental health issues because a lot of it is, for one, unrecognized and untreated. So it's really hard to gather statistics. Prevalence is statistics. So he said something to the effect that it's like 1% or less than 1% for NPD. But to be honest, because people suffering from NPD, people who are narcissists, don't recognize that they are narcissists and don't recognize that they need to get help. So how can you count, how can you take official statistics on people who don't think that they have a problem, so therefore they don't seek help for that problem? And it kind of goes along the line of antisocial personality disorder. I think it's even said that, serial killers, not their mental health, a lot of them are, can be diagnosed with antisocial personality disorder, obviously. But the prevalence of serial killers in America, we don't truly know how many serial killers there really are out there because they're so damn good at what they do. We don't know. And in some cases where you have people, I think it's Henry Lee Lucas out of Texas, he supposedly claimed he did so many killings, but there's no proof that he really did it. And so some people say that, he claimed to have killed more people than he really did. Well, is that really true? We don't know. Could have been a serial killer. And if he did make that claim, say he said that he killed 40 different women, but in truth he only killed 4, well then who killed the other 36? So how do we know that there's not one other serial killer out there who killed the 36? How do we know that there's not 50 other serial killers? Well, you can't have 50 that killed 36 technically unless they work together. But you get what I mean. So prevalence is really difficult when it comes to mental health statistics. So I prefer that people don't focus on statistics when it comes to mental health. And for your own sanity, just know that you're not the only one suffering from certain things. I went through some pretty harsh depression, some harsh anxiety, especially over the last 2 years, and I think it has to affect part of the reason why I got so sick. I ignored my own physical health because my mental health was slipping. And this is where it's going to get a little tough. Sorry. In the medical community, we've lost a lot of really good people over the last 2 years. And it's not because of the pandemic itself. We've lost a lot of healthcare workers to their own hand. Sorry. We've lost a lot of healthcare workers to their own hands because they just couldn't take the stress anymore. Because for the foreseeable future, it's not going away. I'm so sorry, you guys. My own mental health took its toll. I stopped caring about myself. I wasn't going to my doctor because I didn't want to tax my own doctor. She was going through it too. She had a lot of elderly patients that she was having to see. She's elderly herself. And we as a community of healthcare workers are very stressed out. So I tell you guys, please put on your masks. Stay away from people you don't know, at least 6 feet. Get your vaccines and pay attention to your health. I'm so sorry. This is unexpected. And especially, if anything, take care of your mental health. Don't be like Chantal. Pay attention to what your body's telling you. If anything doesn't look right, feel right, sound right, smell right, don't go to Dr. Google. Go to your doctor. So, if you've stuck with me, I've managed to turn an 11-minute video into an hour and a half. Please like, comment, subscribe, leave a dislike, leave a nasty comment. I don't care. I'm not doing this for the money. I'm doing this for my own mental health. It's fun. Oh my goodness, you guys. Go subscribe to Dr. Grande. Enjoy his videos. He does have a very dry sense of humor, and if you're really paying attention, you'll hear it. And he makes some of the worst jokes in the world, and you'll love it. You'll absolutely love it. And you guys, don't forget to do something good for yourself today and every day. And it doesn't have to be anything major. Just do something good, okay? Have a good one, and I'll see you in the next one. Bye-bye.